Hello, Aminta.
Hi, Marie. How are you?
Good. Thank you so much for joining me today. As I shared off screen, I'll share again. I'm really excited to have you because you are going to be discussing something that is a little bit near and dear to some of my friends that are in the fitness industry because they work with some older people. So I will let you go ahead and get started. The first question I have for you is, how did you become a yoga therapist? What was your journey?
My journey originally was I had a lot of medical issues and I was dealing with a lot of pain. So what happened was that I was recommended a specific teacher because she was a physical therapist, and I wanted to be careful to whom I was going to go take class with because I didn't want to hurt myself anymore. And
Mhm.
interestingly enough, if I would go, for example, and do a kickboxing class, it would be fine while I was doing it, but it would take me 4 days to recover from it after that. Like I would be in severe pain. So I was hesitant to do anything. And then I went to this teacher and it was amazing. It was I worked. She actually had us work really hard, and she was very specific in cueing the breath and very specific in allowing us to find where we needed to be. And it was interesting because what happened was the next day I woke up and there was no pain. Um, this that being said, I was dealing with I was taking a lot of medication because of the pain issues. And I was over 200 pounds, and I was just a mom, and I was trying to do a lot. So finding time for myself was just difficult. But we made the time. We made the time so that I could go. And so twice a week I would go do this yoga class. And what happened was, like, in 3 months I realized I was feeling better. My I was sleeping better. My I wasn't taking as much pain medication. So I go to
Mhm.
the doctor, my rheumatologist, and he's like, "You look different." And I was like, "Anything new?" "Well, I'm taking yoga." "Oh, it's something else. I know it's gonna be something else." So he dismissed it. Um, but what happened is by during the process of me going through this pain thing, he had me do a journal for pain. So there
Okay.
were, so I continued to do yoga for I was about a year, and I had some flare-ups. And
Mhm.
it was painful. And then I decided to go through and just kind of look to what was happening. And I realized my flare-ups would happen when I had stopped doing the yoga. So, like, if I had to be gone for
Mhm.
2 weeks. And so I was like, okay, so here's a correlation. So
Mhm.
I continued my practice. I went from like 10 medications to two. Um, I just felt better,
Wow.
and I was happy. I was really happy. And it was good because my girls were all under the age of 6 or 5. So they needed their mom too, and they needed her to be
Right.
happy. So anyway, so I continued to do that. And I think I took yoga for about 5 more years, and I decided I was going to be a yoga teacher. And I started noticing, and the reason, what is really funny, was some of my friends would say, "It's time for you to be a teacher," because I'd stop doing something that we were doing in class and start watching other students. And usually
Mm.
I go, "Isn't that beautiful? Isn't that her hips a little bit off?" you know, but I wouldn't say it, but I was
Right.
thinking it.
Right.
And so I decided, let's go get a teaching certification. So I did my initial, but my intention, Marie, was I wanted to teach seniors. I wanted to
Mhm.
teach the elderly because because of the pain that I had been experiencing. I was always in a doctor's office, and I was always around seniors. And you saw them walk out with little white bags, their medication, a new medication or something. And in one of my visits, when I went to see the rheumatologist like a year and a half later, I asked him, have you told, your patients about yoga? He said, no. And I said, it would help them. And he said, yeah, he goes, but sometimes, they're doing their thing. And it wasn't that he was anti-yoga. I don't want to go in that direction. It was simply that
Mhm.
it was information that wasn't being shared. So
Mm,
that is where my mission started. I wanted to help the elderly move, using the breath and feel safer when they were moving. Because I think as we get older, we start to lose our confidence in how we,
absolutely.
yeah, about, we're a little more cautious about how we are navigating ourselves in our world. So, out of nowhere, I found this advertisement for Duke Integrative Medicine, and
Mhm.
they had a senior yoga teacher training. So I was like, this is all me. And then part two of it was they had yoga therapy for seniors certification. And I was like,
Mm,
in. And I'm not going to lie to you. I did not want to go and teach the senior community till I was properly trained because I didn't want to hurt them.
yeah.
So this was the greatest opportunity for me. And I can tell you to date, to this date that I'm here, I took that certification in 2008, and I actually still use the stuff that I learned, little nuggets. I call them little yoga snacks that I can apply. And believe it or not, I don't just apply it to my seniors. When I'm working with a 20-year-old or a
Mhm.
30-year-old, they come out, but it's all useful information. So that is how, I started there. And then within a few years, well, I was specifically teaching seniors, and then within a few years I got a call to teach Parkinson's. And I was like, I don't know about this. To be honest, I don't I mean, when I went to Duke, it was a small sliver of the pie that we learned Parkinson's. So um then they said, it was a trial. They said it's a trial for 1 month. We're going to try it out to see, if we can bring more people in. I was just like, well, if if they fire me, that's okay because it's a 4-week class and I'll do my best. So immediately I hit the books. I hit the books to start learning how individuals with Parkinson's were using, or how we could use yoga for people with Parkinson. And I kid you not, we started off with one class that was a trial for one time a week. So 4 classes a month, and we are now at like 24 classes a month. So
Wow.
the
That is awesome.
and our reach is further. So I'm teaching out a little bit further other than the Charlotte area. And I'll be honest with you, it's I want to say that how did I become a yoga therapy? I think I became a yoga therapy because I wanted to better serve my students. And I wanted to tell them why. I think you and I've
Yeah.
discussed that before. Sometimes
Mhm.
we're limited in what we can share because it's out of our scope. It's for
Yes.
or it's an orthopedic surgeon or something. But I wanted to explain. So hence, then I started eyeballing in 2014. I think was the first year that MUIH, Maryland University of Integrative Health, where we both graduated from. Um, I noticed they had this one, you know, diploma that I couldn't find anywhere in the world, but it was yoga therapy, a master's in it. So I was just like, okay, this is it. So I had been waiting till it was the right time for me and my family. And that the time came, and it's been rewarding, and it's nice to say that I feel like I'm right where I need to be right now.
Yeah. That is wonderful. That is an amazing journey. I was thinking about when you were speaking into the fact that you actually use some of these skills with your younger people, because often I think that the injuries that we receive when we're younger or the traumas, they continue to build if we're not paying attention. So something that can feel small in your 20s can become a bigger issue as you get older because guarding starts to come in. The thought process around pain, might drive you to be more, inward, maybe isolate, stop moving as much, stop reaching out to your support systems, right? So there's so many things that can happen within a lifetime. So being able to share, what you're using on the back end, right? The front end gives people skills from out the gate, so to speak. So that's
Absolutely.
awesome. Yeah. And then to help build a program, 24 classes in a week. Yeah.
No, I'm
We
sorry,
definitely have an agent.
24 classes in a month. I'm sorry
Oh,
if I,
excuse me, 24 classes. Yeah, 24 classes in a month. That's wonderful. So yay. Okay, so now we've come to the point where you have now graduated, you're a yoga therapist, you're starting to definitely bring this out into the world. How do you how do you use your skills as a yoga therapist versus a yoga teacher with Parkinson's and senior citizens?
I still periodically will teach just a regular yoga class.
Mhm,
And I'm alignment based, so I'm going to be more conscientious about, you know, what kind of class they get based on
mhm,
movement and less injuries and so on. So I can give a class. I've been doing this long enough. Most of us are that can teach. We can go give a class and you can come out and feel good and you can sweat and the next day you feel fine. The difference between doing that and how I deliver the classes right now, with my Parkinson's, with my seniors, and believe it or not, even if it's just a regular class at this point, because I feel like I can, is that
mhm,
a lot of what we are able to do as yoga therapists is to discuss the research and the scientific evidence that is out there to support how what we're doing is actually beneficial.
mhm,
And I think that is huge because obviously we had clinical experience.
mhm,
Uh, we had a lot, that I thought it was interesting, and you might giggle when I say this, but I'm the why person. Why this and why that? And
mhm,
so, I keep back thinking if I wouldn't have asked why, because there were a few times in school where I was just like, I don't necessarily want to know how this part of the brain, what this, and I just sit there. And but it's all part of the clinical experience. It's
mhm,
all part of the science, and
mhm,
that is what I believe to be critical for our yoga therapy world. In that, when we are speaking to our clients or we're networking, even with other doctors, to let them know that we're going to stay in our lane, but we've also got a tool that can help with healing. And my approach is, when I look at, or if I'm treating someone who's a senior, I don't just look at their posture. I don't just look at their breathing. I ask them how they're doing. You know,
mhm,
I ask them, what do you eat on a normal day? Do you drink water? And while these are simple questions, they provide valuable information.
mhm,
So, as a yoga therapist, I believe that we're going a few steps forward and we're filling in a lot of blanks, which to me puts the puzzle pieces together.
mhm,
So, if I want to get an idea about why um, my I have a Parkinson's person that he's been carrying his head down a lot lately. I that particular person, I'm going to be asking him, are you anxious?
mhm,
Have you experienced depression?
mhm.
What is there anything new? Are you on new medication? When was the last time you saw your doctor? Because inevitably, maybe not, there might be another reason that he's feeling a little withdrawn. And maybe he's
Mhm,
carrying his head low. I'm not a doctor. I'm not a clinical psychologist, but you know, bringing awareness. There's an education piece as a yoga therapist that we're able to provide our students. And that is allowing them, number one, to become aware of the space that they're occupying and how they're occupying it. So
mhm.
that's one thing. So believe it or not, one of my funnest things is to be able to teach them something, because they'll come back and they'll repeat it to me. It doesn't matter if you're 80, doesn't matter if you're 90, doesn't matter if you have Parkinson's. They'll come back with that information. So I think as a yoga therapist, we can provide more substance, um,
Mhm.
and be more supportive. And in areas where we might be fortunate, and I'm a little, I'm not going to say too much, but I do have the opportunity to have, because I've been doing this a long time, to know people that if I've got a question, if I have a physical therapy question, I call them up and I'm
Mhm.
saying, is this pose not good for them? And obviously it's a yoga therapist, it's a physical therapist that does yoga, and they'll say,
Mhm.
stay away from that, or I'm like, I'm going to send them to you because I this is not, I can't go here and feel comfortable. So
Right,
I think we just have a lot more substance that we can offer our clients.
right. Yes. And, going back to, our program, the clinical program, we did do a lot of research, especially around neurology,
Yeah.
which we did learn about Parkinson's. Um, and that is definitely a gift. There were times that I myself also felt frustrated because I felt like I wasn't necessarily prepared for the depth of the things that we were going into. But coming out of it on the back end and going, oh, wow, this now, like it all came together, right? So when we're looking at our clients, our students giving workshops, we're not just addressing one piece, of the human person, right?
Absolutely.
And when we're working with somebody's nervous system, it's affecting their brain. And so even people, that do not have any issues, to people that do have neurological issues or brain trauma or emotional trauma, we get to come in and help provide these skills that we may have been able to do before, but we do absolutely understand the why now, you
Absolutely.
know, how the brain is affected, the different parts of the brain, and of course the hormones and everything that goes along with that. So we definitely get to affect a person that way. When you're coming in and you have resources that you're drawing from, I think that's a really good example, not just knowing, to stay in your own lane or, wait, this might be a little bit out of my scope, but it also helps to model for other people, including your, um, students and clients, that even if there's nothing going on, finding support, finding resourcing is really important, you know?
I would have to agree. And I know that you and I have spoken about seniors and Parkinson's, and I don't want to get ahead of myself here, but the fact remains is that it is likely that we're all aging. Every day we're aging.
Mhm.
And what we may have been doing in our 30s is very different than what we're doing in our 50s.
Yes.
And there's a psychological component there. There's a physical component there. There's energetic component there. And those are the things that I think that were really driven hard in our studies, uh when we were saying look at the entire person.
Right.
Um gaining not just a lens for, okay, well, they have poor posture, we're gonna have to work with that. No, no, we're going to look at what it is. Maybe he was a tech person for 40 years, and we're dealing with, some forward, I call it forward heavy
Mm.
posture here. That's not going to be fixed overnight. First, we got to let him know that's happening, you know, and then all of a sudden they're starting to make, that effort to bring themselves back up. So I think that allowing us to look at things from different perspectives and recognizing that everybody is
Mhm.
different, is very different.
Yes.
So
Yes.
yeah.
And I do actually want to speak into something that you just said. They may not even know that they have that forward head posture or forward heavy, as you said. So there is definitely a huge piece of education that we also do, so not just in helping provide the tools and showing people how these tools are, but to also feel and sense into themselves, because you're absolutely right. There are many people, I myself have actually struggled with my own injuries where I'm not aware of them. As a personal trainer too, I've I have told my clients, I go and see a personal trainer. I have a personal trainer because what I see and what I'm feeling is sometimes very different from what the field sees. And then I'm like, oh, that's why my knee hurts, you know? And then of course, science, we know that the further out the head goes, the heavier it is on the spine.
Yeah, absolutely. And I think that you just nailed it when you said we do provide education. And I think that's
Mhm,
a piece that really differentiates us too from a teacher versus a therapist. Because
mhm.
we're giving you the why, but we're also empowering you in the process. And I think
Yes.
that is one of the most beautiful things that I have been able to witness as a teacher and using a therapeutic approach with yoga is to watch someone who wasn't aware about how
Mhm.
they held themselves. And then all of a sudden you see this lift. And it's,
Yeah.
you know, um, this is the part where my seniors and my parkies, I call them my babies. And so I, like I said, um, we when we are in our 30s, our lives are very different than when we are in our 60s. So we don't use our muscles in our body the same way. So
No.
we have to learn. And while sometimes, I can get a student that'll come in or a client that comes in and says, that just tickles me. Well, I'm here because somebody said that this would be good for me. And I'm like, okay, so what? And I asked them, why did they say that? And then what do you think? Because I think it's very important. A lot of times we forget how we feel,
Mhm.
if that makes any sense. So something that I came up with, and I came up with it this past year in school, was I call it the drone effect. And I tell people, pretend that you're a drone and look down at how you're holding yourself up. No judgment. There's no judgment. Look, if you're comfortable, and just
Mhm.
just look and just become more aware of you. You are occupying space. You are important in this equation. And I
Mhm.
think, and that's where, you know, um, as we get older, we tend to kind of shrink up a little bit. I'm like, no, 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 no,
Yes.
no, no. I want you to open up and take up that space. It's yours. It's designated for you. So again, well, Maria, I could talk about this all day.
I love that you empower them with take up space. It's yours anyway. I have clients that I've used similar language with because they're maybe younger, but emotionally, right? So I deal with a lot more of the emotional aspect with the clients that I have, um, at least currently, you know. Um, it's this kind of little ebb and wave that seems to happen over the years with clients. They kind of shift and change over time, but Um, what I find really interesting is that some people have learned at a young age, right, to take up less space, to not be seen or heard, to not shine as brightly in the world because they might affect other people. Um, to live in fear and to draw in. And that kind of goes back to what I was saying earlier about these are compounded things. So somebody who is drawing in at age 20 is going to maybe not show some of the same physicality of someone at 40, right? By 60, you're seeing from not even the neurological piece, from the emotional piece, right? Which of course affects the neurology, right? You're starting to see that weight almost like drawing and pulling them down and inward. So for you to be able to come in and say, and shine, this is the rest of your life, right?
And there's so much stigma associated with aging, or
Mhm.
also with any kind of diagnosis that someone may incur. And the main thing there is, just through my own life experiences, I try to remind any of my students or clients, I try to remind them, you're not your disease.
Yeah.
You may have this, you may have been diagnosed with this, but you're still John, you're still Susie, you're still the same person that's just been in this same body for however many years. So I
Right.
think that that is, again, uh, allowing, empowering, whatever we want to use, so that we can redirect our clients' perspective.
Yes.
And I think that that's something that yoga therapy also does.
And that's what I was about to say. That's another aspect of yoga therapy is that we do work with the mental and the self-reflective. So, would you like to speak a little into how you use that?
Okay, so I have a student, and this particular student asked his wife to not invite the grandchildren anymore,
Mhm.
and to come over to the house because and so we were just talking. This was just a casual conversation after class, and I said, "But those were your like kiddos, you've spoken about them for years." And he said, "Yes, but I don't want to hurt them."
Mhm.
And I
Oh,
said, I said, "Why would you hurt them?" And he said, "Because I fall now and I have tremors." And I said, and he goes, "And I don't want to scare them." And I
mhm.
sat there real quiet, and I said, "Well, um, hmm, I think that you're still their grandpa to them. So maybe grandpa should sit them down and just tell them what's going on."
Yeah.
And really, when I speak, when we were talking, because there was a lot of that was a lot of emotional stuff going on there. And
Mhm.
there was fear, there was just, he was ashamed. To a degree, he was ashamed. And so the one thing that, we just took baby steps, and I basically said, "What do you want to do?" So he said, "Well, it's just we have all this stuff." And I said, "Well, maybe you should talk to your wife about rearranging furniture." And I want to say that probably within 6 weeks, and again, I didn't do anything. All I did was ask him what it was that what made him feel like he was going to fall, and what made him scared. And so then he asked his wife to come talk to me, and I said, "I think you just need to readjust his space." I said, "I think, and I think you need to let the kiddos know what's going on with grandpa, and then grandpa can start feeling a little more comfortable because he's not having to hide."
Right.
And so they went back to something like, in the summer they did movies on Saturday nights and so forth.
Mm.
But the emotional component is one that I walk softly on, Marie, because some of it I don't want to go and take care. I don't want to misdirect anyone, is what I want. I want to be
Mhm.
respectful. that. But really seeing like that was important information. You know,
Right.
that was huge, and it made and that's where the therapy, that's where the yoga therapist thing comes in, because um and again, I'm leaning towards the Parkinson side, but you know, sometimes as we get older, we have depth perception issues,
Right.
you know, and we have to address those in such a way that is non-threatening to the person who may be experiencing them, as well as to the people that are around them.
Right.
So I just think information. I think that we as therapists just go in there and we take that information and we try to figure out if there's anything that we can do within our scope to
Hmm.
help. And but it takes, you know, it takes baby steps. And the emotional component is one that uh impacts, you know, this, it'll impact the way we hold ourselves up.
Right.
It'll impact the way we breathe. It can cause anxiety, you know, and these are the things that I feel that again is that information that we're getting through this intake, through this conversation.
Right. And that just speaks into the therapeutic healing container that we provide, because you saw, you heard, so he was seen, you were aware, and you gave him an option that he maybe possibly wouldn't have had you not taken that information and been like, oh, well, what about this as an option? So you provided, luckily for him, he was able to take that little nugget and now gets to spend time with his grandchildren.
And he feels better. So that's the main thing. Ultimately, um, I want to say that even when I was just as a teacher, my whole goal was to hopefully get you to feel better at the end of the class than you did when you came. And that's what I'd like to I want that to be the case with yoga therapy, knowing that, you know, it might take a few more steps, but that's okay.
Yeah, yeah. So along your journey, working with Parkinson's and seniors, what stands out to you the most in terms of how yoga therapy has provided a space in the clients and the students that you're teaching that works well alongside the Western medical model that we live in or use and utilize here?
Um, you mentioned support
Hmm.
earlier, and I think that that is critical when you're talking with the senior population, because our needs change. And with regard to working complementary to, you know, with a physical therapist, with a speech therapist, by the way, these are all people that that will and can address needs that occur as you get older. So um, it's interesting because sometimes the exercises that I will do are similar to the ones the speech pathologist does.
Okay.
Okay. And so the speech pathologist in this case, the student said, my teacher does that. And so then I didn't know who the speech pathologist was. And so then the student came and said, here's my speech pathologist business card. She wants you to call her. And so she was inquiring about what I was doing, what was my intention behind what I was doing. And I said, hey, if there's anything, and she was fine with everything. And she was just like, I said, if there are any exercises that I can incorporate into my classes, please let me know. I'm not going to step on your toes, but if we can work on getting them a deep, you know, because this was talking about they also start to lose their voice. They're not as loud. So little things that I do in class to help, you know, strengthen this area, the face and the throat, all of that is helpful. So I think in turn, it working alongside, it only makes your wellness team stronger. You know, I'm a big believer in that. If we can all work together, it's or at least know of each other, that the other one exists. Should we
Mhm.
find a need for that, for something they can offer, then we send them that way.
Right. And that is also part of being a clinical yoga therapist, is that we were trained to work with possibly other people, like the doctors, the physical therapists, the speech, therapist, right? So we do have that ability to interact with them as long as, of course, our students or clients say yes, if they agree to that. But it makes a stronger team, a stronger support system for not just your clientele, but for anybody's clientele.
Yeah, absolutely. I mean, I just think that it's important, it's part of that education piece that we can also
Mhm.
offer, which is to let people know that, um, there is a caregiver support group over here. Because sometimes if you have a couple, or if you have someone with kids, all of a
Mhm.
sudden, there's needs. So we can be a resource all day long. But it is just helpful. I think that that's where we go out on a limb a little further, because we can.
Right.
And but it's I think as we get older, sometimes we tend, it's my observation, to associate aging with losing our zest,
Mm,
losing our vibrancy.
yeah.
And I, on the other hand, think there's so much wisdom that oozes out of these individuals, that if I
Mhm.
could just grab a bowl and collect all of it, I would have
Mhm.
so much. I mean, even the ones that are angry, we have somebody that I work with, someone, they're like, oh, here comes Grumpy Pants. I'm like, leave him alone. He's been through something. Leave him alone. And
Grumpy, yes.
it's just, I think that we need to be cognizant of that,
Yeah.
because a lot of us might thrive on zest, when we're younger. So we're not running that triathlon anymore. We're not that
Mm.
CE.
Well, I think you hit a little bit of this earlier in our conversation, but at least here in the Western side of, humanity, we don't necessarily applaud aging or see it as something positive. It has more of a negative connotation to it. Um, in indigenous tribes, you know, the elderly become the wise, right? When you were speaking, it's the first thing that I saw in my mind were the ladies like on the East Coast. I remember seeing they were on the East Coast with their little hats, right? And they dress up all crazy. There's nothing that speaks to toning that down. They are vibrant and they just learn, or maybe, they were taught when they were younger, but they come into this age in their life where people are basically expecting them to slow down and kind of be somewhere else, and here they are with their hats and they're just vibrant, like they're absolutely vibrant, and they step into their individuality and thrive. And so I think that if we as a society actually offered more space to allow them to feel like they're thriving and living and being vibrant because they have wisdom, they can teach us how to learn to be more present in our own lives. Because when we're younger, we think we're going to live forever. But as you get older, clocks, it's the clock is ticking. So how do you live the rest of your life? Which is, a question that we also can bring up as yoga therapists. Like, how do you want to live the rest of your life?
Exactly. I think that's a really good question. And it's one that unfortunately a lot of individuals, when they get to of age, retirement, let's just say retirement, um,
Mhm.
they feel like, I've basically worked my whole life. They've been doing this, going all the way up, and then
Yep.
comes after that, but that's the part of rediscovering self. You know,
Mhm.
that's that part of being able to recognize that I'm not done yet,
Right.
and there's much to offer. And again, there's that, Marie, there's that redirecting. Let me show you the lens of where there's a senior community that I work at. And these ladies and gentlemen are a mess. But every Tuesday, they have the school closest to them come in and they help children read.
Oh,
So
wow.
there you go. It's again, it's
Right.
redirecting so that, you know, if I mean, let's face it, if we're going to sit around and isolate ourselves, we're not going to be able to get the best of us
No,
or offer the best of us. But all of a
no.
sudden there's the interaction. So there's a big
Mhm.
social component to aging and doing it with zest and doing it like the red hat ladies.
Yeah.
There really is. And sometimes I think, at least from a yoga therapy perspective, it's seeing what else is there, rediscovering this little part of themselves that maybe they didn't know they even had.
Yeah. Exactly. That's I think I have a new mission on my mind. Well, I am absolutely just thrilled to have you share your knowledge and hear about what you're doing in the area of the world that you're in. You did say that you would like to share a little practice with us.
Yes. So, what I want to share with you right now is something that I utilize for, my, actually, well, I'm going to just say my seniors and Parkinson's right now. And as we
Okay.
get older, we don't socialize as much. I'm giving you the reason why. And so we lose a lot of strength in our facial muscles. So a lot of times, something like, when you're eating, you might see somebody where their food falls out. you know
Mhm.
so we want to strengthen these muscles and we want to stimulate the circulation. That is an example that I'm giving you for, like, for seniors. With Parkinson's, there's masking, and sometimes one of the side effects of Parkinson's is that they kind of lose the mobility aspect of their face,
Mm.
so it becomes expressionless. So what we do is, we do certain things that help the nervous system, that stimulate circulation in the face, and that also help with toning. I'm giving you all the benefits first. And another thing that a lot of my seniors experience and parkies is swallowing. Sometimes the food gets caught in their throat. So one of the exercises we're going to do today is going to help with that.
Okay.
So you are you ready?
I am.
Okay, so go ahead and sit up nice and tall.
Okay.
Take a deep breath in and a slow breath out. And we're going to work with what's called Brahmari breath. So that's the buzzing bee. So what I
Okay.
want you to think about is you're going to exaggerate all the face. Even if you think you're not, I want you to do it. Just exaggerate, and you're going to try to find this sound. So just listen. Zzz, like a buzzing bee. Zzz. So we did 2 rounds of that. But what I like to tell people to do when they do this is I want them to put their fingers right around their throat and their cheeks. So when they're doing this exercise, they can feel what's kind of happening whenever they do that. So put your hands there. And now you're going to remember that sound. We're going to inhale and then zzz. We're long breathers. So a lot of times people will use this when you have sinus congestion.
Mhm.
This really activates this area right through here. So you can probably feel, if you had your hand here,
Yeah,
just
I felt that. Yeah.
waking things up. So it's an excellent exercise for the things that I have mentioned. But we also, another thing that we do is we just do bubbles. And I just pretend I do this all the time when I get to babysit little kids. And I'm just like, let's just do bubbles. And we go,
That's so fun.
okay. And again, I tell them to think of their mouth as a muscle, and that it needs to be a strong muscle so that it can hold everything in. So
Ah,
that's empowering to them, by the way. All of it,
yeah.
because they know that this is happening. And
Mhm.
then the next thing is we're going to sing a little bit. You ready to sing, Marie? We're going to sing the vowels. So when we do this, we won't do it for very long. It's just a little
Yeah.
sample. Um, Again, we're stimulating circulation.
Okay.
And we're kind of giving it, we're waking up everything in this area. So we're going to sing the vowels, and we're going to take a deep breath in, and on the exhale, we're going to do the letter A. So inhale.
Mhm.
A. So exaggerating again, really emphasizing, and a lot of jaw work here to help with our chewing.
Yeah, I
So,
felt that. Yeah.
okay, and now we're
Okay.
going to go. Ready? Inhale. E. And it just, when we do these letters, different things start to work, and we just don't,
Yeah, I felt that a little deeper. Yeah.
yep. And that was more into the swallowing. And then
Okay.
I, so this really works the jaw. So inhale. Ah. That helps us when we're talking, because a lot of times we stop talking and we just mumble, and the voice goes
Mm.
slower. So it's softer. So again, opening, really learning how to. And then my least favorite one, because it does something with my lips. Oh, no, it's O. No, we're going to O. U is my least favorite. So let's do O. Inhale. Oh.
So does
Okay.
that
And
like
then
strengthen the lips?
right here, you're really working on different, I mean, it's amazing. It's not just, it's not just your face, it's cheeks and chin and
Yeah.
all kinds of other. And here comes the U. So, and this really does something to my lips anyway. I've gotten better. So inhale. You.
What does it do to your lips?
For that again, we're trying to strengthening. It's that
Yeah.
kind of flexing,
Hmm.
expansion, flexing, really just moving, and we're stimulating. A lot of times we can't feel. We lose our the ability, that it's kind of like helps us with tactile, that kind of
Okay.
touching. So we really all of this helps with volume of your speech. It helps with expression. It helps with talking. It helps with
Mm.
strengthening the tongue, the mouth. It really is, there's so many tools that we have in our yoga box that I love this one. A lot of times I will do the chakra sounds.
Oh, okay.
So I mean, and some of them will know because they're like, this is some of that yoga stuff, right? And I'm like, "Mhm." But yeah, so it's a great it's just a mini exercise. I don't know if you remember this, but I call these yoga snacks.
Hmm.
And I'm like, when you're in the car, I pretend I'm Adele. I don't know who they, I'm just pretend you're a certain, and just don't lose your voice, because I tell them that's how you're letting somebody know I'm here.
Oh, yeah. I like that. So are you going to share the the chakra sounds with us?
Oh, you want to do that?
Yeah.
Okay. All right. Well, here we go. The first one is going to be lam. Okay. So we're just going to take a deep breath in and lam. The next one is vam. Inhale. Vam. Next is ram. Inhale. Ram. Then we have yam. Inhale. Yam. And hum. Inhale. Hum. And some people know this one. This is the third eye. It's our om. So we're going to inhale. Om. And then the one that is like our bliss, and we're just all there. It's your own. So we're going to inhale. Om.
Oh, nice.
And just like we were doing the vowel sounds, all of this
Hmm.
is vibration. And sometimes we talk about, we feel stuck. We feel like
Hmm.
I'm like in a rut or something like this. And all of these movements that aren't something that we practice every day. I will tell you that we'll be holding warriors and I'll have them do chakra sounds
Hmm.
or blow bubbles just to integrate the two things in there. And
Right.
but anyway, that's a great exercise for individuals that might want to work on their speech and some facial.
Mhm. Yeah. It's interesting. I was thinking about all the different ways too that we can stimulate the vagus nerve and tone the vagus nerve. And so for people who might be sympathetically active, um, that would be a really also a good way to help tone
Actually,
the vagus nerve.
I have that in my notes, and I didn't mention this, but that when we were doing the facial yoga and all of that will stimulate your parasympathetic nervous system instantly and the vagus nerve. So there's a correlation. There's a lot going on when we can do those things. So just that I missed that, but I'm glad you mentioned it because that is something that we want to. And again, I say this from age 3 on, calm the nervous system, everybody. And just by making these sounds, they're good for us.
Yeah. And of course, under the age of 3, kids are walking around all the time going,
So they're taking care of that muscle.
I'm just laughing because for both my son and my daughter, I've been told that I've taught them that.
You can tell them that your last session, your last podcast,
Yeah,
you had somebody trying to teach you how to do bubbles.
yeah, exactly. So I have questions for you if you're willing and open. So we had discussed having you come on a couple of times. Hopefully you'll still be up for that. But one of the things that you did bring up earlier, and I think it is important to kind of talk about it. Um, Nothing too big because we can always go into it in a different interview, but is the caretaking.
Mhm.
So that's something else that you also seem to hold near and dear to your heart.
Yes. It was after the COVID when we had a whole bunch of well, we were isolated. So I
Hmm.
was actually teaching online, but I never really got to see my people. But
Yeah.
when they came back, I was my heart hurt because what I saw were caregivers that were exhausted and worn out. and frustrated and angry and all kinds of things. But they don't get a chance, you know. They may be bringing their seniors, or their parkies to class to take yoga, and they can participate. But at that time, we're directing all of our focus on their person. But I
Mhm.
wanted to see, I wanted something for them. So in our studies, I don't know if you recall, but I decided there's caregiver syndrome.
Yeah.
And caregiver syndrome is, just being exhausted, but you haven't really had a whole lot of time, and your outlets are limited because you're
Mhm.
having to focus so much on your person. And so that is something I decided to, with some of the research that I learned in school, I decided to put together a program where now we're meeting weekly. It's 4 weeks, 4 times a month, and it is 2 Zooms and one and two in person. So we get a further reach for the Zooms, but
Yeah.
it is amazing. Again, talking about support, it is
Mhm.
amazing what this group of true warriors um are sitting there, and they're disclosing what they may be dealing with. And then it's kind of like, I tell, first of all, everything's confidential, but then I always tell them,
Mhm.
I'm like, just pretend that, whatever you had to say was water and it's going down the faucet. It's not going to be held against you. It's gone.
Mhm.
But you were able to let it out. So we use a lot of breathing, lots of breathing techniques. um I've helped them, or they have created their own yoga toolbox, so that they can, have a space at home with whatever they need, and it's defined differently for every person. We talk a lot about who we were,
Mhm.
who we are, who we want to be, and it's
Mhm.
nice, and not to lose self, not to lose
Right.
self. And I think that um this support group is intended to remind them they're just as important as their person, and
Yes.
how they feel, matters. So yeah, that's what we do.
That's awesome. I really look forward to having you back on and going a little bit of a deeper dive into caregiving, because I know that people are aware that there's caregivers, for seniors and Parkinson's, but there's caregivers that have, children that might have, something going on, partners, as I think you did mention, um, children who are taking care of, their adult parents, as well as children and working. So caregiving comes in many forms, and really, we do caregiving to some degree in almost everybody's life. So I do think that's an important piece to address. So that way you can normalize some of the frustration that comes into caregiving. But as you said, the toolbox to help to take care of yourself and to remind yourself that there's more to you than being a caregiver, and to really help people to fill their cup back up so they can be better caregivers. So
Isn't it amazing all the things that our yoga can help?
yeah,
I'm a
I've been
fan.
teased about that before. It's
I
like,
got some
well,
for you.
exactly. And so, my last and final question, where can people find you?
Okay, I got a website.
Mhm.
I sent that information to you.
Mhm.
Basically the website, and everybody has access to my email and to my phone, and I will answer. If I don't answer, I'm probably teaching, I'm with a client, but I will call you back. You can comment on the website, and I will respond to that too. Um,
Mhm.
I'm accessible, and that's as long as I can be, that's how I want it to be.
Okay. So what part of the United States are you in?
I am in Charlotte, North Carolina. And so depending upon if it's some of your crew, I'm going to be 3 hours ahead of you. I am known to work at very different times to accommodate people. And I'm just open to that because it's a service as well. So yeah.
Right. And you did mention on-site things that you do. So where on site do you do your workshops or teach? Is there a
When I usually I have I use space at a Pilates studio actually. And
okay.
that's where I would offer workshops and whatnot. That's where
Okay.
my caregiver groups meet. So I've got
Okay.
those. Sometimes my senior, if I want to recruit more seniors, it's a senior driven type of workshop. I will
Mhm.
use facilities at senior communities so that I can get more people to come in.
Okay. And then I heard you mention Zoom, so people can also find you via Zoom.
Yes, and I'm getting ready to open up another yoga class, and I'll be posting that, which I want it to be for seniors and Parkinson's. But
Okay.
again, the thing about those classes, right? Because a lot of times it took me a while. People will just shut their camera off, so you don't know if you're teaching into the abyss. But I
Right.
pretend to see you. Pretend I see you and I see you doing that free posture. So yeah. Anyway, it's just one of the but Zoom is definitely a thing. I meet people on Zoom a lot, actually.
Wonderful. Well, Aminta, thank you so much. I look forward to our next conversation.
Me too.
Have an absolutely wonderful day. And thank you again for sharing not only your journey, but some of the things that we can also bring into our practices, or share with people who might be in a space where they have a senior or Parkinson's person that they can go blow bubbles with.
Absolutely. Thanks, Marie. Thanks for having me.
Thank you.